Chapter 20. Prescription Opioids. A few key facts. Prescription opioids covers many different pain-relieving medications, from buprenorphine to fentanyl, oxycodone, or tramadol. Prescription opioids are depressants. Their popularity, unfortunately, is growing in many countries. They're consumed via skin patch, swallowed, snorted, or injected into the skin, muscle, or blood. Timescale varies depending on the particular substance, and some effects include pain relief, relaxation, nausea, slower and shallower breathing, and weakened pulse. There are not many days that go by at the moment where there isn't a news report discussing what is often referred to as the opioid crisis. In the USA, but also Canada, Germany, and other places around Europe, the consumption of opioids has been rising for some time, and so have opioid-related deaths. In the UK, opioid use is predominantly the use of heroin and morphine, but in other places around the world, opioid use can refer to the use of prescription opioids. Prescription opioids are medications prescribed for their pain-relieving properties. A number of medications fall under this title, including fentanyl, tramadol, buprenorphine, oxycodone, hydrocodone, codeine, and morphine. They can be administered in a variety of different ways, which can make them a useful and versatile pain medication. They can be given orally, as tablets or lozenges. They can be administered through the skin via a patch, and they can be administered via syringe, under the skin, into muscle, or directly into the bloodstream. This chapter is a slightly different format to others in the book. If you're interested in the short and long-term effects of opioids, have a listen to the chapter about heroin, as they are broadly similar, although different opioids have slightly different profiles. In this chapter, I'll explore a bit about why prescription opioids are appearing in a book that is not about prescription medicine. Who uses prescription opioids? Sometimes people who use opioids will begin to do so having been prescribed them by a doctor. This could be for a variety of illnesses, for recovery after surgery, chronic pain, or any number of reasons. Problematic use of prescription opioids can also be particularly common in professional sports people, either after treatment or in a prophylactic way, allowing them to play through injury, but without support to come off them. Sometimes opioids will be prescribed for severe pain or managing pain after surgical procedures. Opioids are also extremely useful in end-of-life care, particularly for individuals with cancer pain. Opioids of all kinds can induce pain relief, feelings of euphoria, and relaxation. They can also impact on breathing, slowing it down and making it shallower. They can cause constipation, which is why they're occasionally prescribed for people with diarrhea. For some individuals, opioids can induce nausea, vomiting, and dizziness, and reduce appetite. There are a number of different opioids that are prescribed for many reasons and in a variety of circumstances. Some are synthetic, while others are semi-synthetic, having been derived from the opium poppy. Morphine and codeine are directly extracted from opium. Perhaps the most well-known prescription opioid at present is fentanyl. This substance is synthetic, created in a lab, and similar to morphine, but around 50 to 100 times more potent. Fentanyl has had a lot of media attention because of its potency. This greatly increases risk of overdose, especially if the person consuming it is unaware that a powder or tablet contains fentanyl. Overdose on opioids of all kinds is dangerous because they slow down a person's breathing rate. If breathing is slowed enough, a person can lose consciousness and potentially die. Opioids are also dependence-forming. After using them for a while, people require a higher dose to achieve the same pain-relieving effect. People can experience strong cravings for the substances, and people can experience unpleasant withdrawal symptoms if they stop taking them. Cravings and withdrawal might be one reason why individuals who are initially prescribed opioids will sometimes continue taking them off prescription, and tolerance may be a reason why individuals move from a lower risk method of consumption like tablets to a higher risk method such as injecting, where there are further dangers of infections, skin damage, and blood-borne diseases. How effective are opioids as pain medication? Opioids are extremely effective for the relief of acute, that is, short-term pain, particularly pain that doesn't respond to what might be considered more standard pain medications such as paracetamol, ibuprofen, and aspirin. For all the risks we know about prescription opioids, are they actually any good at long-term pain relief? The evidence is surprisingly thin on the ground. While they are proven to be an effective treatment for acute pain, such as pain following surgery, there's not that much evidence that they are an effective treatment for longer-term pain, even before their dependence-forming risk is taken into account. Public Health England have released guidance for clinicians when prescribing opioids called OPIOIDS Aware. Their guidance states that while a small proportion of people might get a benefit from long-term use of opioids, it's very hard to identify who these people are, and benefit is often seen only when use is intermittent rather than continuous. They also state that use should be discontinued if a patient is still experiencing severe pain after taking opioids, even if there is no other treatment available. In 2018, a clinical trial was published comparing the effectiveness of opioids, including oxycodone, fentanyl, and hydrocodone, known as the brand name Vicodin, in patients with back problems or knee or hip arthritis. A group of 234 mostly male participants were randomly prescribed either one of those opioids or non-opioid pain medications, ibuprofen or paracetamol, and followed up for a year. The participants rated their pain using questionnaires at the beginning of the trial and follow-up time points. The study found no difference in pain between the groups at the start, both rating their pain at around 5.5 on an 11-point scale. The non-opioid group reported an average lowering of 2 pain points at the end of the trial, and the opioid group a slightly smaller decrease. There was no evidence that opioids performed better as a long-term pain reduction treatment, and the authors of the study took their findings to mean that these risky medications should not be prescribed if they are no more effective than pain medications that don't have such a high risk for dependence or overdose. If they're not that effective, why did opioids become so highly prescribed? The rise of opioid popularity can be traced back to the USA in the 1990s. At this time, there was a huge outcry that pain was being undertreated. And while this outcry was happening, opioids were being advertised on TV as effective pain treatment. In the early 2000s, prescriptions for opioid pain medication in the USA boomed, but so did the use of the substances off prescription or illicitly. In 2012, opioids were the second most common substance being used recreationally, as opposed to being used as prescribed, in the USA after cannabis. By 2014, it was estimated that over 10 million people in the USA were using opioids outside of prescription. Why has problematic opioid use hit the USA harder than other places like the UK? It could be related to differences in the way healthcare is provided. In the USA, healthcare is privatised and generally paid for by people's insurance. Alongside this, medications are advertised on TV, and doctors are offered incentives by pharmaceutical companies to prescribe certain medications. The level of insurance that a person has might also impact on the type of treatment they get. For example, an individual with chronic back pain might benefit most greatly from an expensive physical therapy intervention, but have only a lower level of insurance, so may not be able to claim for anything other than pharmaceuticals that will mask the pain rather than treat the underlying cause of the problem. However, given the rise in opioid prescribing elsewhere in the world, such as Canada and even the UK, where opioid prescription is rising, the explanation might not be this straightforward. People who were initially prescribed them, particularly in the USA, and where prescriptions are expensive rather than subsidised by a national health service, might seek out cheaper illicit opioids when this becomes prohibitively expensive for them. There are additional risks from illicit use. Heroin laced with fentanyl has been seen on the street, which people might knowingly or unknowingly buy and consume. Where the substances are powders, they might be improperly or unevenly mixed together, making it very hard to predict the dosage accurately. And that is assuming that the person knows the contents of the powder. There are huge risks from individuals consuming fentanyl when they believe it to be another, less potent opioid or another substance entirely. There have been reports in the UK and the USA of fentanyl being sold as other substances such as Xanax tablets. In the UK, fentanyl is often found in base form, meaning it can be smoked or injected. In the USA, it's more common in salt form, which is only suitable for injection, a riskier method of consumption. Why is it so hard to stop taking opioids? Withdrawal from opioids can be extremely unpleasant. A heavy flu that can last a number of weeks, as well as anxiety, panic attacks, and insomnia. And often the people who are using opioids are doing so for complex reasons such as chronic physical or emotional pain. The combination of these symptoms returning, plus the withdrawal symptoms, can be extremely hard to manage, particularly if they are trying to do so without support. Opioid withdrawal symptoms have been seen in the babies of women who use the substances while pregnant. Some reports suggest that withdrawal symptoms are worse in people who use opioids recreationally rather than for a medical reason, but this might be due to taking higher doses or a lack of support through the process of reducing the dose and stopping taking them. Is there any way to make prescription opioids less harmful? As detailed earlier, there are a number of different opioids, and each has its own unique profile in terms of potency, onset, and such like. As such, some opioids are less likely to lead to overdose or dependence than others. As well as this, efforts have been made to create less risky slow-release versions of some opioids. For example, oxycodone is a fast-acting and long-lasting opioid. After consuming it in a tablet form, it will reach peak plasma concentration within 30 to 60 minutes and last for 3 to 6 hours. But a modified version has been created, where slow-release oxycodone is combined with naloxone, a substance that blocks the effect of an opioid directly at the receptors in the brain where opioids bind to take their effect. It's the same substance that can be used to reverse a heroin overdose, bringing people straight out into withdrawal but possibly saving their lives. The combination of oxycodone and naloxone might reduce the potential for dependence forming after use, and it also reduces the constipation that can be caused by opioid use. The peak plasma levels of oxycodone after taking the slow-release version are at around 3 hours, rather than half an hour. This mixing of oxycodone and naloxone has a further benefit. When naloxone is taken orally, it doesn't stop the effect of oxycodone in the same way as it does when it's injected to prevent overdose, by blocking the receptor sites at the synapses in the brain. However, if an individual tries to grind up their oxycodone pills and inject them, the naloxone will be effective at blocking the oxycodone, meaning this isn't a viable way of consuming the substance. It is hoped that this will further reduce the risk of harm by preventing injection as a consumption method. Myths and misconceptions. You can overdose on fentanyl just by touching it. This is a really dangerous myth. It began with media reports of police officers in the USA reportedly falling unconscious after touching powder believed to be fentanyl. A police officer was said to have collapsed after brushing a small amount of fentanyl powder off his uniform. More scary still, despite being administered with naloxone, he could not be revived immediately, although in all instances where this has occurred, the officers have made full recoveries. It is vanishingly unlikely that these officers collapsed due to touching fentanyl. While it is possible for fentanyl to be absorbed through the skin, an individual would need to be exposed to a large amount of the substance for a prolonged period of time. There is a risk if fentanyl powder becomes airborne and it is breathed in, but again, the amount of fentanyl in the air is unlikely to be encountered by police officers at a crime scene. The American College of Medical Toxicology has published a position statement after these reports started appearing. They point out that the symptoms reported by these police officers were not that consistent with an opioid overdose. Overdose symptoms might include slowed or shallowed breathing, rather than dizziness or anxiety, which were examples of the symptoms reported by police officers. Some have suggested the officers might have been having severe panic attacks rather than experiencing opioid overdose. And who could blame them? If you'd heard that this substance could kill you simply by touching it, then experiencing extreme fear at doing so is a natural response. This myth is potentially a danger to emergency responders, but it's also a danger to individuals who might be at risk of overdose from fentanyl. If emergency responders believe they need to take extreme precautions before entering an area where fentanyl might be present, this could delay their ability to provide life-saving interventions like naloxone. So this is a myth. What can be done about the opioid crisis and rising deaths from opioids? While the President of the USA has declared the rising death toll from opioids as a public health emergency in the USA, and there are many lawsuits being filed against drug companies who market these substances. What is being done to prevent deaths in the USA and elsewhere? There are a number of different levels at which this problem can be tackled. In the UK, for example, some police forces have been provided with naloxone, which can be used to bring a person who is overdosing out of intoxication and hopefully save their life. In Canada, as we've heard earlier, the governments are encouraging organisations to set up drug consumption rooms, where individuals can go and take substances in a cleaner, safer environment than having to do so clandestinely in the street. These rooms can also test substances for the presence of adulterants, test individuals for bloodborne diseases, and provide education and social support. There is currently a call for such provision to be provided in Scotland, where deaths from opioids are extremely high, on a par with the USA percentage-wise. Unfortunately, across the UK, drug treatment services have been cut dramatically over recent years, meaning people who are vulnerable and at risk are in all likelihood finding it much harder to get support. At the other end of the scale, we need better understanding of why opioids are being overprescribed in such volume in certain countries around the world, and whether there are other options for dealing with chronic pain that are more effective and less risky.